Ever wondered how to differentiate between lumbar disc herniation and sacroiliac joint subluxation? Well, you're not alone. These two conditions, both linked to debilitating back pain, often confuse even the most health-conscious among us. Lumbar disc herniation, a condition where the soft center of a spinal disc pushes through a crack in the tougher exterior casing, differs from sacroiliac joint subluxation, a misalignment or malfunction of the sacroiliac joints, which connect your spine to your pelvis. Understanding the differences between these two conditions is not just about satisfying curiosity, but also about better managing your health. In this video, we will delve into the intricacies of each condition, comparing their causes, symptoms, and management techniques. By the end of this video, you'll be better equipped to identify and understand these conditions, empowering you to take charge of your health. You're about to understand the key differences between these commonly misunderstood conditions. Starting off with lumbar disc herniation, a condition that affects many worldwide. This common health issue occurs when the soft, jelly-like center of a lumbar disc pushes against its outer ring. Picture it like a jelly donut. When squished, the jelly leaks out. This is similar to what happens in a lumbar disc herniation. The jelly pushes against the outer ring, leading to pain and discomfort. So what causes this condition? It's often a result of normal wear and tear. As we age, our discs naturally degenerate and become less flexible. However, it can also be triggered by lifting heavy objects without proper form, prolonged sitting, or sudden trauma. Now, onto the symptoms. The most common one is lower back pain. However, if the herniated disc is pressing on a nerve, the pain can also radiate to other parts of the body. This is why people with lumbar disc herniation often experience pain that extends to their calves and even their feet. Other symptoms include numbness or tingling and weakness in the affected area. But here's where it gets tricky. There's a common misconception that lumbar disc herniation always results in severe pain. However, it's important to note that the severity of the condition doesn't always correlate with the intensity of the pain. Some people with severe herniation feel no pain, while others with a small herniation experience intense pain. So, it's crucial to listen to your body and seek medical attention if you experience persistent pain that doesn't improve with rest and over-the-counter pain relievers. And remember, while it's common for people to attribute any lower back pain to lumbar disc herniation, it's not always the culprit. There are other conditions such as sacroiliac joint subluxation that can cause similar symptoms. With that, we've covered the basics of lumbar disc herniation. Now, let's move on to sacroiliac joint subluxation. Now, on to sacroiliac joint subluxation, a condition not as well known, but equally important to understand. Picture a hinge that connects your spine to your pelvis. That's your sacroiliac joint. Subluxation refers to the partial dislocation of this joint. It's a subtle misalignment that can bring about a world of discomfort. The causes of sacroiliac joint subluxation are numerous. Often, it can be traced back to a sleeping posture that's doing more harm than good. Picture this. You're a side sleeper, and your top leg tends to drift forward as you snooze. This overextension places stress on the supporting ligaments of your sacroiliac joint, and over time, this can lead to subluxation. Age and fatigue are also contributing factors, making the condition particularly prevalent among the elderly. The symptoms? The most telling sign is a pain that radiates down your leg but stops short of the knee. This is a key difference between sacroiliac joint subluxation and lumbar disc herniation, which often sends pain all the way down to the calves and feet. There are misconceptions, of course. Some believe that sacroiliac joint subluxation is a rare, unlikely condition. The truth is, it's more common than you might think. In fact, it's often misdiagnosed as lower back pain or even hip issues. Now, let's talk about relief. Exercises can help alleviate the pain from sacroiliac joint subluxation. One helpful routine involves lying on a firm bed, hugging your non-painful leg, and gently guiding it towards the opposite side of your body. Holding this position for 5 to 10 seconds can do wonders. For added relief, you can cross your painful leg under the non-painful one, and have someone press gently on your knees 3 to 5 times. Practice this daily, and over time, you may find your pain significantly reduced. Remember, the back of your head, coccyx, and medial ankle joints should all align vertically. This is a handy way to check if your body is straight and to maintain a healthy posture. Now that we understand both conditions, it's time to compare them side by side. Understanding the differences between these two conditions is crucial in identifying them. Let's delve deeper into the comparison between lumbar disc herniation and sacroiliac joint subluxation, with a focus on differences in pain location, causes, and symptoms. Lumbar disc herniation is characterized by pain that can extend all the way to the calves and feet. This is a distinct feature that sets it apart from sacroiliac joint subluxation, where the pain typically spreads to the legs but does not extend beyond the knees. Now let's consider the causes. Lumbar disc herniation often results from strain or injury, but sacroiliac joint subluxation can occur due to a habitual incorrect sleeping posture. In particular, side sleeping with the top leg positioned forward can overstress the ligaments over time. This habit, when combined with factors like aging and fatigue, can lead to the development of sacroiliac joint subluxation. The symptoms of these conditions also vary. Lumbar disc herniation can cause numbness or weakness in the leg or foot, while sacroiliac joint subluxation often leads to discomfort in the lower back or hip, and can even cause a feeling of having long and short legs. By understanding these differences, from the location of the pain to the causes and symptoms, we can better identify whether we're dealing with lumbar disc herniation or sacroiliac joint subluxation. With these comparisons, it becomes easier to distinguish between these two conditions. We've covered a lot today, but what are the key takeaways? The crucial distinction between lumbar disc herniation and sacroiliac joint subluxation lies in the pain's location. The former can extend to your calves and feet, while the latter generally remains above the knees. Incorrect sleeping posture can lead to sacroiliac joint subluxation, particularly in the elderly. Regular exercises can help alleviate pain. Remember, if you're experiencing any of these symptoms, it's important to consult with a healthcare professional. Until next time, stay healthy.